How REZUROCK belumosudil works for chronic graft-versus-host disease. Use: REZUROCK belumosudil is a prescription medicine used to treat adults and children 12 years of age and older with chronic graft-versus-host disease, chronic GVHD, after you have received at least 2 prior treatments, systemic therapy, and they did not work. It is not known if REZUROCK is safe and effective in children less than 12 years old. Please see important safety information at the end of this video. Chronic graft-versus-host disease, or chronic GVHD, is a complex and difficult disorder that may happen to some people after a blood stem cell transplant. In chronic GVHD, stem cells from a donor attack the body's cells because they see them as a threat. This disrupts the harmony of the immune system, causing it to become unbalanced. This leads to inflammation, also called swelling, and fibrosis, also called hardening or scarring, which can damage your organs. Healthcare providers may try different medicines, including immunosuppressants, to help treat chronic GVHD. However, for some people, that might not be enough, and they will need a different approach. An innovative approach is to use a medicine that blocks a pathway in your body called the ROCK2 pathway. In people with chronic GVHD, this ROCK2 pathway is too active. This leads to a decrease in cells and molecules that help keep the immune system in check, and an increase in cells and molecules that cause inflammation and fibrosis. The result is an immune system that is out of balance. REZUROCK is that medicine. It works differently to block the ROCK2 pathway. REZUROCK is the only approved medicine for chronic GVHD that specifically blocks the ROCK2 pathway. It may reduce inflammation and fibrosis and help rebalance the immune system. When the immune system moves back toward balance and harmony, people with chronic GVHD may see an improvement in their condition. And rock on! Rock on with REZUROCK! Use: REZUROCK belumosudil is a prescription medicine used to treat adults and children 12 years of age and older with chronic graft-versus-host disease, chronic GVHD, after you have received at least 2 prior treatments, systemic therapy, and they did not work. It is not known if REZUROCK is safe and effective in children less than 12 years old. Important safety information. Before taking REZUROCK, tell your healthcare provider about all of your medical conditions, including if you have kidney or liver problems, are pregnant or plan to become pregnant. REZUROCK can harm your unborn baby. If you are able to become pregnant, your healthcare provider will do a pregnancy test before starting treatment with REZUROCK. Tell your healthcare provider if you become pregnant or think you may be pregnant during treatment with REZUROCK. Females who can become pregnant should use effective birth control during treatment with REZUROCK and for 1 week after the last dose. Males with female partners who can become pregnant should use effective birth control during treatment with REZUROCK and for 1 week after the last dose. Are breastfeeding or plan to breastfeed? It is not known if REZUROCK passes into breast milk. Do not breastfeed during treatment with REZUROCK and for 1 week after the last dose. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. REZUROCK may affect the way other medicines work, and other medicines may affect the way REZUROCK works. Know the medicines you take. Keep a list of them to show your healthcare provider and pharmacist when you get a new medicine. How should I take REZUROCK? Take REZUROCK exactly as your healthcare provider tells you to take it. Do not change your dose or stop taking REZUROCK without first talking to your healthcare provider. Take REZUROCK 1 time a day with a meal. Take REZUROCK at about the same time each day. Swallow REZUROCK tablets whole with a glass of water. Do not cut, crush, or chew REZUROCK tablets. Your healthcare provider will do blood tests to check your liver at least 1 time a month during treatment with REZUROCK. If you miss a dose of REZUROCK, take it as soon as you remember on the same day. Take your next dose of REZUROCK at your regular time on the next day. Do not take extra doses of REZUROCK to make up for a missed dose. If you take too much REZUROCK, call your healthcare provider or go to the nearest hospital emergency room right away. What are the possible side effects of REZUROCK? The most common side effects of REZUROCK include infections, tiredness or weakness, nausea, diarrhea, shortness of breath, cough, swelling, bleeding, stomach, abdominal pain, muscle or bone pain, headache, high blood pressure. Your healthcare provider may change your dose of REZUROCK, temporarily stop, or permanently stop treatment with REZUROCK if you have certain side effects. REZUROCK may affect fertility in males and females. Talk to your healthcare provider if this is a concern for you. These are not all the possible side effects of REZUROCK. Call your doctor for medical advice about side effects. You are encouraged to report side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. You may also contact Cadman Pharmaceuticals, LLC, a Sanofi company, at 1-800-633-1610 to report side effects. Please see full prescribing information at the adjacent link or at REZUROCK.com. If you have questions about chronic GVHD, whether REZUROCK is right for you, or any potential side effects, please ask your healthcare team. For more information, visit REZUROCK.com.